Mr. President, I'm going to talk about one of the topics, and maybe both of them if I have time, that the Republican leader brought up today, talking about the new numbers that have been released on the president's health care plan. Yesterday, the administration announced that slightly more than 4 million people, 4.2 million people, have signed up for health plans through the exchanges. As we all know, that's substantially below their first goal and substantially below their adjusted goal just a few weeks ago. One of the things that in a effort by the Washington Post to find out how many of those people hadn't had insurance before, the group that was supposedly served well by this, it's about, their estimate was in an article also this week, it was about 1 million people. An incredible amount of effort to add 1 million people to the insurance rolls, particularly with the stories from the millions of people that were on the insurance rolls that come to all of our offices every day, stories that clearly reflect problems with this law and problems, more importantly, for the American families that are impacted. I brought a few of them with me today, things that since I was here talking about this topic last week have come to our office. And again, these are stories where we've reached back, contacted these people, said that I was going to come to the floor with their story. I'd mentioned their first name and where they're from, but no, are they concerned with that? And time after time, people say, oh no, we want this story told, which is why we reached out to you. Gary in Lake Ozark, Missouri says what so many people are saying, that his deductible is now the problem. In fact, his deductible on the policy that he can now have, let me just read what he said. Before I knew I was able to stay on my company plan, he's going to be able to stay on his company plan a year longer than he thought he was just a few months ago. Before I knew I was going to be able to stay on my company plan, I went to the exchange to seek coverage. I found a plan available to me but was shocked to learn that my deductible was going to be over $8,000 per family member. This is quickly becoming the new group of people that aren't able to meet their health care cost. I met with a number of healthcare administrators, hospital administrators from Missouri recently. They said their fastest growing category of unpaid bills, of unpaid debt, are from people who have insurance, because so many people with insurance now have a deductible that is a deductible that they believe they can't pay, and because they believe they can't pay it, they just simply don't pay it. So whether it's the $8,000 on Gary's policy or the other lower amounts, hopefully I'll find some lower amounts here in a minute. Mac, here's one right here from another Gary. This Gary's in Southeast Missouri. His wife's deductible went from $500 to $1,800. Story after story. And what happens, Mr. President, when you have that growing deductible, whether it's the $1,800 or the $3,000 or the $8,000, if it was $500 and that was all you were going to have to pay, you might figure out how to put together $500 or maybe even more than that. But when you see a $1,800 number or a $3,000 number, an $8,000 number, apparently people that used to pay their $500 deductible just say, well, I can't possibly pay that, so the hospital needs to write that off, I guess, as bad debt. They're going to come after me for $7,500 just like they would have for $8,000. So a deductible that used to be reasonable and was paid, now the family looks at that and says, we can't possibly ever get to that deductible, so really there's no reason to even start down that path. I have a whole list of Garys here on top of this. I don't think they're all making up the name Gary, but they are Gary. This one's Gary from Higginsville. I could have organized these to have a little more variety in the first three. But Gary from Higginsville, Missouri, they said that his prescription cost for his premium for Humana Gold Plus Medicare Advantage and his co-pays have all gone up significantly. He's concerned about Medicare Advantage, which just a few days ago I was here. In fact, I ran into this person reading his letter, and I said, I'm the man you spoke with outside Starbucks in Independence, Missouri, across from the mall. You leaned down to my car door, to which the window was down, and he had called me over to talk about Obamacare. What's changed is that several of my medications have gone up in price. My premium has gone up for Medicare Advantage. My deductibles and co-pays have gone up. And things that are the result of the cuts made in Medicare now actually cost him the money that used to be paid for by Medicare. You know, when you cut Medicare $500 billion to start a new program, somebody who was on the old program is going to be impacted by that. And it's not like, Mr. President, when we debated this, we said, well, this Medicare program is in such great shape that now we can start a new program and use money from Medicare to do that. That was done right in the face of the understanding that Medicare, one of the principal obligations that the country has made to retire people over 65, going back to 1965, that this was a program that wasn't going to be able to support itself. So what did we decide to do as a Congress? And I voted against it, and I'm glad I did, but the ultimate decision was we're going to cut Medicare to start a new program, and we'll see what happens to a program we already know is in trouble when we do that. Frank from Kansas City's policy was canceled for not meeting the Affordable Care Act requirements. So he was forced to sign up on the exchange for himself, his wife, his 22-year-old daughter, his 19-year-old son, his 11-year-old daughter. Frank was told that his 11-year-old daughter would qualify for Medicaid. He submitted 3 applications that they said they'd never received. And after 2 months, they asked him for additional information about his daughter, including tax information not available till April 1. Because of all this, the Affordable Care Act is causing his daughter to go uninsured, according to Frank, until at least June. And this is like one of those states that has an exchange that the states have set up in a couple of places, have never been able to sign up one single person. And now it's not October 1, it's now much closer to April 1. And this system is just not meeting the needs of families or meeting the goals that clearly it's set for itself. Farrell from Versailles, Missouri, said he's facing financial hardship because his employer cut his hours to avoid covering his health insurance. The employer told him that Obamacare was the reason they were cutting his hours. He was teaching at a community college as an adjunct professor for 8 years. He said he quit his full-time job because according to him, he was teaching 4 courses each semester and a course over the summer, and that appeared to be meeting his needs. But suddenly, the new law comes along, and his employer says, if you work as much as you've been working, we'd have to provide health insurance. You know, Mr. President, something that you and I think would both be interested in too here, and having worked together for a long time, is seeing the response that even local governments and state governments have had for people that they always, because they thought it was the right thing to do, provided health care to. But suddenly when the federal government says, here's what you have to do, then that drew an interesting line across our society. That also means if you have to do this, you don't have to do anything for people who don't meet that requirement. And the 30-hour work week, the impact that's had on people. I was at a location the other day, and I said to the manager of the store, how are you doing meeting that? This was, I thought, going to be a skill discussion. How are you doing with the skill levels you need to find here for people who are dealing with customers? And he said, well, it's harder all the time because now we have to hire 4 people where we used to have to hire 3 people, because nobody knew that we're hiring is able to work more than 29 hours a week. So instead of finding 3 people to do that job that work 40 hours a week, said now we're having to find 4 people that work less than 30 hours a week. And I went on to say that managers and people who are already at work said nobody's getting their hours cut, but when we're hiring new people, we're doing what our competitors are doing, which is hiring part-time people that don't have benefits. Emmett at Lake Ozark, despite the fact that he was paying all his premiums through his employer dropped early retirees from the company policy. He didn't feel comfortable submitting his information to healthcare.gov, he says, for security reasons. And by the way, nobody contends that this website is secure or that the information you put on it is secure. In fact, just the opposite. Every indication's been it's not secure. He did say he used the website to find a plan, but 3 months later, when I finally got a quote, it was unaffordable and much higher than the quotes I was able to find outside of the exchange. Bob from Wentzville said he's seen his insurance increase by 15% over the past 3 years. I feel like writing back to Bob and say, based on all the other letters, 15%, you should be feeling pretty good about that. But nobody feels good about a 15% increase. It's just that so many people are seeing an increase that's so much higher than that. On the other hand, his insurance's premiums have increased by 15%, but back to the earlier discussion, his deductible has gone from $500 annually to $4,000 annually, or $8,000 for the family. Is this the kind of insurance that families need for what they used to pay a premium that was just a little bit less, 15% less, but they had a $500 annual deductible, not a $4,000 annual deductible? Beverly from Potosi went to her doctor for her annual screening and was told she could only have one now every 2 years because of the Affordable Care Act. Although her risk of cancer increases with age, she believes she's getting less care than she got before. Holly from Jefferson City is a registered nurse who's now working 2 part-time jobs. She's living paycheck to paycheck. Here's what she says in her letter. I'm a registered nurse that's only working part-time at 2 jobs. I live paycheck to paycheck like most people since the economic crisis. I'm barely able to keep my bills paid, much less able to add another one. I am upset that my right as a U.S. citizen has been taken away from me to decide for myself if I want health insurance or not. And I think she could have added to that and decide for herself whether she wanted it or not and what she wanted. Now, I can't really quite tell what the president's latest announcement was, but it appears to be that if you had insurance, even if it's been canceled because it didn't meet the qualifications, now somehow it's not canceled, and how you deal with that as someone who's maybe gotten another policy or maybe moved beyond the insurance you had and don't qualify to go back. I don't know how many times we can change this law without just finally admitting the law is not working. Let's take everything we know now, which is so much more than the country knew and most members of Congress knew when the law passed. Let's take everything we know now and go back, Madam President, and do this the right way. Jason from Pleasant Hill and his wife purchased plans through their employer, and again, they experienced price increases without added benefits, and in fact, with less benefits than they had before. So just one letter after another, Madam President, that comes to our office in various ways every day. I could stand here and read them for a long time, but if I read the clock correctly, I think my time is out and we're ready to move on to other business, and I would yield the floor.